Welcome back to Fox 5's On the Hill Live this Sunday morning. The Trump administration plans major cuts at the U.S. Department of Veterans Affairs. It could mean 80,000 job losses or 15% of the VA workforce. This could hurt America's veterans, or is it necessary to get the deficit under control and improve services? We're pleased to welcome the U.S. Secretary of Department of Veterans Affairs and a former U.S. veteran, Doug Collins, on the Hill this morning. Mr. Secretary, thank you for being with us.
It's good to be with you.
So obviously, when the headlines hit, it made a lot of people apoplectic. 80,000 people. That's 4 Capital One arenas at capacity.
Right.
Who are these workers? How will this affect veteran care? Because at the end of the day, that's what this is all about.
Tom, thanks for that. Let's put this in perspective. For the last 10 years, the VA healthcare system has been on the high-risk list for GAO. 10 years. You know, there's some out there that want to think that before we got here and started actually looking at this, that the VA was perfect and everything was going fine. It really wasn't. 10 years being on the high-risk list. So when you look at this and you take a step back and you say, what are we doing and how are we doing it effectively? And one of the things we're looking at here, and this is, as you see numbers being thrown out there, this is a deliberative process that's going to be going through, in which we're actually going to take and look at our healthcare system, look at our benefits, and say, what do we need to be doing? How do we do it better? Because at the end of the day, our job is to provide services for our veterans. And when we do that, then the people are getting their benefits. And also at the same point, then maybe we can take a honest look at what GAO has already said, being on the high-risk list puts us at risk for fraud, waste, and abuse, puts us at risk for having patient care and quality go down. So that's what we're looking at.
Who are making these decisions, though? Because as we spoke to Congressman Harris just a minute ago, that's a big question for people. Folks voted for Congress.
Yep.
They voted for the president. The president chose you. Who's actually, at the end of the day, making these decisions?
I am. And our team is making the decisions. And I think that's what I want everybody to understand. Quit worrying, quit being spun up by what we're seeing in the media. People wanting to talk about, well, this, this agency behind the scenes, this somebody's pulling the curtain over here. Because what we're seeing is we're getting recommendations. But at the end of the day, I was the one that raised my hand. Ours is the one as the secretary. And the president made it very clear just the other day that we're making the decisions going forward.
You did something this past week that maybe some of the other secretaries might want to do. And that's, you wrote an op-ed in the Hill detailing a lot of this. And one of the things you wrote was that the goal of the VA is to reduce levels to 2019, roughly 398,000 employees from our current level of 470,000 employees. But we also added here, and we didn't hear a lot about this, the department is going to continue to hire more than 300,000 mission-critical positions to ensure that health care and benefits for VA beneficiaries are not affected. 300,000 people are a lot of people. So what are those jobs going to be? And are the people who are being laid off going to be eligible, or would they be properly in a place to fill some of those jobs?
Well, this is something I think we need to look at here. As we look at this and that the number that we're talking about, that's 300,000 we protected. So all the people out there who are saying, the VA cuts, and there's been 2,400 layoffs so far at the VA, going forward, that we're having this fundamental depression in VA healthcare and VA benefits. I want to put this in perspective. That's 1/2% of our workforce, 2,400. And they were all in what we call non-mission critical assignments. So those 300,000 we protected.
When you were in the House, you were probably the best person to cut through what I call bureaucraties, okay? When we say non-mission critical, what are you talking about there? What are people doing that they shouldn't be doing?
Well, just in some of just to give you some of the examples of job descriptions, we had clerks that were in the back. We had interior designers. We had, staff that was duplicative in certain agencies from, again, working in the back rooms of areas. One of the things that we were finding is that people who are frontward facing, those who are actually helping the veteran, taking the calls, also doing the benefits, are not being cut. They've not been touched. This is another thing to realize. Did you realize in the last 4 years, the budget at the VA went up $130 billion, and we added 80,000 employees? And actually what happened in that time is as our backlog on benefits actually went up.
One of the reasons it went up was the PACT Act. This was the promise to address comprehensive toxins, passed in 2022. This was about the burn pits.
Yep.
These large areas of garbage that were just set on fire to dispose of it because, there were military troops around them. They inhaled it, and it was connected some illnesses as well, too. What would the status of the PACT Act be under this initiative?
It's still going to be fulfilled. I'm actually, for those out there wondering, I'm actually one of those burn pit people. I've actually was served in Balad in Iraq and right next to a burn pit. And what the Congress did is actually pass law. We're going to continue to fulfill that mission. But sometimes what we have found is that you use something like the PACT Act and say, well, we're going to throw money and people at something. But at the end of the day, are we actually making the cuts and make it in a way that actually helps the veterans? So the PACT Act's going to get implemented. We're going to do that just as we're supposed to.
No surprise to you, you've had your critics about this in the administration. Patty Murray, who's the top Democrat on the Senate Appropriations, said that this is a full-scale, no-holds-barred assault on veterans. Even Jerry Moran, who's a Republican chair, said on the Veterans Committee, says they need to legislate necessary changes. There have been some in Congress saying, hey, what about us? Or are we part of this? Does the House and the Senate have a role in all this?
Well, I think they have a role in it, but like I said, I would encourage them to, to be a part of the process and to work with us and see what we're doing. Again, I have to emphasize, 0.5% of the workforce. That's what we're looking at. This has only been in the process the last 3 weeks. Anything that's coming up to say that we're all of a sudden changed, I just happen to them, the same members of Congress who've been there for a long time. The last 10 years, we've been on a high-risk list.
This has always been a tough job,
yes,
being the Secretary of Veterans Affairs. You get a lot of criticism, not only from the public, but from veterans themselves who are frustrated about some of the bureaucracies they run into. What is your North Star as you begin this job now? You've served yourself. You've seen these veterans. You know their stories as well. What do you want to do?
The North Star here is this, and it's something that most of these members who actually talk about this, 60% of their complaints in their offices have to do with the VA, either through benefits or health care. My job is to make sure that the VA is not an agency in which someone has to call their congressman or their senator to get the help that they've already earned. If we get to there, then our function is being properly carried out for the first and most important function, and that's our veteran.
What has the president had said to you as far as your marching orders in regards to VA?
It's very simple. He said, take care of my veterans. That's all he said.
When you now enter this job, is it something that you do in regards to your own experience, or do you have to approach this also as an administrator and a secretary as well, too?
All in one. And I think the one thing that I've brought to this job is actually saying that I'm going to ask questions that hadn't been asked, because I'm going to come to this. I don't view this as a career or stepping in the sense of saying what do I do next. Yeah. Mine is what do I do now. So I'm asking, why are we doing this? Don't bring to me we've always done it this way before. Bring to me answers and solutions, because, again, when GAO puts you on a list for 10 years of health care that you're at a high risk, when you look at the situations going on and how we're actually developing, VA has been, as you actually alluded to, we've been the whipping post for a long time. People want to say good things about veterans, but then say, well, you got to fix it. You can't fix it without changing it, and that's where we are.
The government does a lot of important things. Taking care of veterans might be at the very top of that list. Doug Collins, the Secretary of Veterans Affairs. We appreciate you coming in and talking to us in person.